Hello everyone, welcome back to my YouTube channel. Today we are dividing into acute respiratory distress syndrome or ARDS. Specifically, whether you are a medical student or nurse or just curious about how the lung goes into crisis, then this video I have clearly explained about the Berlin definition of ARDS. Today I am directly discussing about the etiological factors of ARDS. The etiology of ARDS are divided into two parts: direct lung injury and indirect lung means primary pulmonary causes. This include one is pneumonia. This may be viral, bacterial or fungal. This infection causes intense inflammation in the lung parenchyma, leading to alveolar capillary damage, and finally it leads to leakage of protein-rich fluid in alveolus. Aspiration of gastric content, stomach acid and enzyme that causes chemical injury to the alveoli and bronchioles, leading to inflammation. Inhalation injury, the inhaled toxin that damage the respiratory epithelium and alveolar membrane that initiate inflammatory contusion. The physical injury leads to alveolar bleeding, inflammation, and it finally leads to alveolar capillary narrow drowning. Inhalation of the water cause direct alveolar injury, surfactant washout. I move on to the indirect lung injury, means the systemic or secondary causes. These originate outside the lung but lead to lung damage via systemic inflammation. Indirect lung injury, first one is the sepsis, especially from gram-negative bacteria. The inflammatory mediator increase the capillary permeability in the lung that causes severe trauma and burn. The systemic inflammatory response indirectly damage the lungs endothelium. Even without direct testis, the enzyme and cytokines released during pancreatic inflammation that enter in the circulation and damage the pulmonary. Massive transfusion, the antibody and bioactive substance during massive blood transfusion that activate the neutrophils that causing the endothelial damage and capillary leak. Drug overdose, some drug that causes systemic inflammation and leading to lung damage. For remembering these all etiological factors, you always keep in mind the word panther. P for pancreatitis, A for aspiration, N for narrow drowning, T for trauma, H for hematologic means massive blood transfusion, E for embolism, it may be air or amniotic, and H for respiratory infection is helpful. So please like, share and subscribe my YouTube channel for more clear and clinical content.